When we do classify surgical instrumentation based on the infection posed to a patient, if we use a medical instrument, what is it called? And how many categories are there within that classification? There's no wrong answer. If you get it wrong, we correct the answer. The Spaulding classification, who's there responding? Patricia. Now Patricia has answered the question. Can somebody else give me the categories of the Spaulding classification? Under the Spaulding classification, we categorize medical instrumentations into 3 categories. And what are those categories?
Critical and semi-critical and non-critical.
Esperanza, give us the 3 categories. Can someone tell me what is the characteristic of a critical device?
Device that's been used in a procedure that involves tissues, membranes. It's a deep surgery, something.
You have an idea. That's good.
Very invasive.
Your most simple answer you can get to is that the characteristic of a critical device is that it enters into the tissue of the body, right? Whether blood tissue, fat tissue, skin tissue, it enters the tissue and touches the bloodstream. That's the characteristic of a critical device. And what is the minimum biocidal requirement for a critical device before it's used on a patient? What is required of us technicians or healthcare givers to do with these medical devices before?
Make sure it's sterilized.
Minimum requirement is sterilization. That's correct. That's the minimum requirement. In order for a critical device to be used on any patient, it has to be sterilized. Now, what is the characteristic of a semi-critical medical device?
I can think of semi-critical device is something you use outside the body, flushing out from one patient to another patient that require minimum of cleaning, like disinfectant wipes, and make sure it's clean well, not to be in contact with another patient.
I'll bring you back, Esperanza. So we're saying that when we categorize medical devices under the Spaulding classification, we are categorizing them based on the infection risk posed by a medical device used, not disinfection. I don't want you getting disinfection confused with the classification of the medical device based on the risk posed. We know that the characteristic of a critical device is entering into bloodstream or tissue of the patient, right? And we said that the minimum requirement for a biocidal activity is sterilization. When we speak about semi-critical device, it enters the tissue of
tissue membranes.
Now, what is the characteristics? Patricia, you were saying the characteristic of a semi-critical is what?
A mucus, it touched the mucus membrane.
That's correct. And what is the minimal requirement in order to use a semi-critical device on any patient?
Is that sterilization?
That's the highest. What is the minimal biocidal requirement for that?
High-level disinfection.
That's correct. High-level disinfection is the minimal requirement for semi-critical devices because they come in contact with mucous membrane going through your mouth, anus, your ear, as long as they don't penetrate the tissue. Non-critical medical devices, what are the characteristics and what are the biocidal requirements for non-critical devices? Anyone?
Low-level disinfection.
Low level to intermediate disinfection, correct? That's what's required. And we know the characteristics of these non-critical devices are they come in contact with what? With intact skin. Stethoscope, crutches, blood pressure cuff, thermometers that are used outside of the body, not under the tongue, because that's a mucous membrane under your tongue. And then we talk about the instrument manufacturing process. What is the first step in the instrument manufacturing process? The selection of the material. In this case, we were emphasizing on metals because we're talking about the 300 and 400 series metals. And under that, we broke it down to the type of metals used for the blades of instruments. We talk about the tungsten carbide, which is characterized by the gold handles or gold rings of the instrument. And we said that tungsten carbide metals, blades or jaws are replaceable in an instrument if it's damaged, compared to stainless steel that is irreplaceable. If it's damaged, it gets thrown out. I want you guys to go back over high-level disinfection, low-level disinfection, intermediate disinfection. And you know by now the first process in disinfection or sterilization is cleaning. We know that in order for a disinfectant to be effective, an item has to be clean, properly dried before it's inserted into any disinfection solution, whether we're using an automated approach or we're using a manual approach. What is the air quality or characteristics of air control in the disinfection room? We said that the air exchange should be what? 10 air exchanges per hour. And what is the rationale of having 10 air exchanges per hour in a disinfection room?
Because of the different chemicals being used.
The fumes these chemicals would emit in that room. It is required to have your personal protective equipment worn every time you perform disinfection. True or false?
Yes.
Why should you wear your PPE?
For splashing and spill.
That's correct, for splashes and spills. We also should be trained on disinfectants used at the hospital. Every new equipment, someone should be your preceptor and to make sure that you have the competency required to operate and use any equipment or disinfectant that is available to you at the hospital. Now let's talk about complex surgical instruments. Your job will be to work with complex instruments. And as technological advances are happening in this day and age, it's getting better and better with instruments that are made of microchips, instruments that are made of silicone parts, some heat sensitive instrument that might require low temperature sterilization